6-week checks. What is a 6-week check, and do I need one? So 6-week check is the word we have to describe the checkup for mum and for baby about 6 weeks after baby's born in that postnatal period. So they are important. My first tip though is don't wait 6 weeks if you have anything important or any concerns whatsoever, because 6 weeks is an awfully long time when you're out there with a baby in this whole new world of parenting. It can be very isolating, lonely, and little issues can become big issues over that time. So don't leave it to 6 weeks if you don't need to, if you're concerned. Now, if everything's going okay, then booking a 6-week check is a good idea. So you might have had your 6-week check with a private obstetrician or with a pediatrician, but if not, that's something that GPs are trained in. And I like to see mum and baby. I will often spend an hour, sometimes even longer, because there's so many things I like to talk about and cover in that appointment, and just making sure that mum and baby are both recovering well and answering any questions or concerns, and doing a physical examination as well. So if with baby, I like to find out about the pregnancy. I like to know about whether there's anything from the ultrasound scans during pregnancy that we need to follow up on or organise after birth. And if that's all been okay, then I like to find out more about the feeding, make sure Bub's growing well, gaining weight. Also answer any concerns, big or small, that you might have about your baby. And I like to also explore how the breastfeeding journey is going, because that can have really big implications, and getting some good tips early on with breastfeeding can make a really big difference. So after I ask lots of questions, I'll then do a formal examination, get baby up on the examination couch and do a top to toe, head to toe checkup, listening to heart, lungs, checking the eyes, feeling the tummy, checking for reflexes, doing sort of a neurological assessment as well. And make sure that there's nothing else important. Checking the hips too is a big one. We always check hips, make sure there's no underlying hip dysplasia type issues that need to be looked into. Then for mum, so with mum, I like to find out again about the birth, a little bit of a debrief if need be after birth too is really important, because every mum has a birth story, and some women need to sort of go through things in a bit more detail and process as well. So there's a huge mental health part to my mum 6-week checks. But making sure that everything's physically been healing, whether it's a cesarean or a vaginal delivery, and also making sure pap smears are up to date, which is now known as the cervical screening test. Talking about contraception, because women can get pregnant even without their period, before their period comes back. So making sure that that's all in place if need be. So yeah, lots of things to talk about, as I said. Other important things are things like pelvic floor, see how that's going as well, and making sure that you've got all the right supports in place to give you the best start on your parenting journey. So, but most important tip, I think, really is don't wait 6 weeks if you have any concerns whatsoever, because 6 weeks is an awfully long time, and seeing your health provider earlier than that is always a really good idea before small issues become big issues too.